healthy for the new year is pediatrician Dr. Jeffrey Hirschfield of Lifestyle Medicine Wellness Partners. Welcome, Dr. Hirschfield. Happy 2020.
Thank you, and happy New Year to you.
Yeah, so you guys use the term lifestyle medicine, and I think I can deduce what that means, but to you, what does that mean?
Right, so lifestyle medicine is actually a preventative type of specialty medicine where we actually utilize our own lifestyle behaviors and factors that contribute to chronic diseases. As you know, chronic disease is a real problem. I'm in a situation as a pediatrician to be able to affect change very easily using those methods that we choose to use, which are preventative approaches, and intervention is a primary intervention.
So when you say lifestyle things, we're talking diet, exercise, sleep, sort of mental well-being, all those things?
Right. So
Okay.
you got it right. There's the major domains, and it's how we act that becomes a major obstacle in some cases. So we have to somehow switch gears. We have to be able to first work with the patient, let them understand us, they understand you. You have to build credibility. It sometimes takes a while, especially if these habits have been going on quite a while. It may take a while to unravel them, but we just want to take little baby steps to get to the root cause of these diseases, which are really harming our nation.
Yeah, so as a dietitian, I can totally identify with that. You see someone, you see a diet, you see a problem, but you've got to get to the person first, to the reason why you have that problem. So for example, is obesity in children something that you would work with?
Right, that's a good point. Yes, absolutely. In my field, in my sphere, we deal with families, which is good. I deal with both the kids and their parents in my practice. So yes, we approach it in a way that is the entire family.
Okay.
If we can engage the entire family, we usually have better success, right? If parents are having certain habits and eating habits and that are not healthy ones, that goes down to their children. So what I find is that the kids are little chaperones, but they tend to be the activists. They're the ones that go back to their parents after we have our discussions and actually come back the next time and say, hey, Dr. Hirschfield, I just made these changes. I'm eating more fruits or I'm eating more vegetables. That makes me feel really good that we are affecting change in a positive way.
And when you say preventative, the idea there would be that instead of prescribing a medicine and someone leaves, you're hoping to change the behavior that would cause you to need to prescribe that medicine?
Yes, that's exactly right. You're right on point with that. And it's very important. It's like having a sink that's overflowing and it's going, all the water's going over the floor. And we're mopping it up, but we're not really, why don't we just stop the spigot? And we just don't do that. And it is kind of frustrating that we need to place these resources in a prevention mode, early intervention programs, screening, so that we can really, really affect change. Until we do so, it's going to be a tough go.
We're going to continue to see these statistics that we hear about obesity or heart disease continue to rise. So do you have an example of some changes lifestyle changes a family might make that would have health benefits?
Right. So that point, that's good, is that we involve everybody in the family, like I said. And we start our major focus on those major domains that you mentioned, alluded to before. The major domains that we focus on are certainly the ones we know, nutrition and fitness. And those are the ones we go after first. And certainly depending on a situation or a person, we may have to add the other mindfulness approach and things like that. But we go after those approaches. And so simple things, let's eat together. Let's eat together as a family. Do things together. Go outside. Do your fitness activities together. We tend to be, in lifestyle medicine, we focus on predominantly whole food, plant-based dietary patterns. And by that, we know so much about what the benefits are of plants.
Yeah, definitely.
Let plants be our medicine.
Don't eat that.
Right, and they're not. They're not eating it, and as we know, we see the outcomes for it. I mean, some simple statistics. I mean, right now, we're seeing in our country, 20% of our kids are overweight.
And so you believe that if more people took on this approach of not just you're overweight, lose weight, but here's some ideas, let me help educate, that would create a better scenario.
Absolutely. So I said that. I think I said it wrong. 20% of our kids are overweight or obese. 40% of our kids are overweight or obese. With 20% being obese. And that's just alarming. Adults, it's 70% are overweight and obese.
It's the norm.
It's the norm. So we look at it, that's the norm. We look at what our beliefs are socially. It's an eating opportunity for going out and socializing. It was tasty, but the foods that we're generally eating are highly processed.
So your goal is to educate us on all the ways that the lifestyle modifications can help us be healthier. If you guys are listening to this and it sounds like something that would be interesting for you, we'd encourage you to visit Dr. Hirschfield's website. It's lifestylemedicinewellnesspartners.com. Thank you so much for joining us. I definitely am on board with that plant-based diet. All right, guys, stay tuned. We'll be back with more Bloom right after this.